and ladies and gentlemen. Now, we have heard an overview of COVID, what is happening in India, and then how the vaccination schedule is. I'll take the example of a healthcare worker scenario and then explain you what is happening with the vaccines, and then I'll try to dispel some of the myths that are there with the vaccine. Okay, the first thing is we were the initial people who took the vaccine in India. As Mr. Deepak pointed out, it was January 16th, and January 25th, I got the first jab of Covishield. Okay, that was early. We were scared. My wife said, "Let us not take both of us at the same time. What if you die if you after taking vaccine? I have to be there for my kids. We'll vaccinate on different." As I said, stupid, don't forget all that. I have seen the data of the vaccines. It is relatively safe. Let us go and both of us let us get vaccinated. And that was on the day one. We were really worried. We did not sleep on the day before we took the vaccine. And that time, you don't even have the vaccine-induced thrombocytopenic purpura. At that time, you did not know that the Oxford AstraZeneca vaccine could cause clots rarely. Even then, we were afraid because we were taking the vaccination among everyone in the world to start with. So we took the vaccine. And that time, a lot of doctors asked me whether it is safe for us to take the vaccine or not. And that was quite a long time ago. And now, none of you will be hesitant to take a vaccine. None of us are still skeptical of vaccine side effects, thanks to organizers who have organized things like this, the seminars like this. Now we know after 74 crores or 75 crores of vaccines that are administered in India, we know that the vaccines that are available in India are pretty safe. One, there is no point. Then the academic discourse shifted its course. And then what they say is, are these vaccines effective at all? Most of the doctors now call me and then they ask me, I don't have antibodies. I got 2 jobs of Covaxin done and now it is 3 to 6 months now. I don't have antibodies. What do you tell me? You only told us to get vaccinated. We got them done. Now I don't have antibodies. What should I do? Now I tell them, see, there are several reasons for antibodies not being there. The number one reason is the antibody tests are not as standardized as vaccines. There are several antibody tests that are available and they are not as standardized as the vaccine. You have nucleocapsid antibodies, you have spike protein antibodies, and you have neutralizing antibodies that the lab people do. And if you take a Covishield vaccine, and if you get a nucleocapsid antibody test done, you will not have any nucleocapsid antibodies after taking a Covishield vaccine or a Sputnik vaccine. Because these vaccines, along with the Pfizer and Moderna vaccines, they target the spike protein of the virus. So you'll have spike antibodies, you will not have nucleic acid antibodies, and then you are unnecessarily worried. So let us say if you have taken Covaxin, which is an inactivated whole virion vaccine, and still you don't have antibodies. Reasons then. Now, the reason number one is, even if the cold chain is not maintained properly, sometimes you may not have enough adequate antibodies, number one. Number two, the second point that you should mind is, antibodies are not the only things that give you protection. The protection in terms of against the viral infection comes with 2 arms. One is a humoral immunity, another is a cell-mediated immunity. Humoral immunity is not humoral. Humoral immunity means the resistance we get through antibodies is called humoral immunity. The other one is known as the cell-mediated immunity. Cell-mediated immunity will still be there even if you don't have antibodies. So, even if you test for antibodies, the assay may not be correct. Even if the assay is correct, you did not get the proper antibody test done, or even the antibodies are absent, still you are protected against the disease. So, these are the 3 important points that you have to understand. Let us say you got the right test done, you did not still have the antibodies, then what should you do? These are some of the questions that my colleagues asked me now. Now, vaccine hesitancy is more or less gone from the upper strata, the higher socioeconomic groups, the urban classes of people, the healthcare workers. In these people, there is no hesitancy about the vaccine. What we need to spread the word is to the rural area, to the lesser socioeconomic group, and people who are in a cult kind of a publicity. There is a cult kind of publicity. They say that vaccine should not be taken, you will get infertility. What kind of a crap is that? It's not true at all. Actually, COVID infection can cause reduced fertility. COVID infection can even reduce your IQ. Even if you have an asymptomatic COVID infection, still you were 3% sharper last year. Let me say that. So it has been proved that after a COVID infection, your IQ may fall up to 3 percentage points. Even your IQ can fall down. You may have long-term effects, especially cardiac effects also. The MRIs which were done after a COVID infection, there is a trial that was done in JAMA, that was published. Almost 80% of the people who recovered from COVID had some abnormality on the MRI cardiac. So that means COVID is much more of a loose cannon rather than a vaccine. Now you say, natural infection will give you protection. My friend got the infection last year. Now he is not getting infection anymore. He is mingling with people without mask. I have got a vaccine, but I am not able to because I am worried that the vaccine may not work as well as the natural infection. Now for that, what I would say is, for those people who have recovered, it is all right. What about the 4 lakh people that have died in India with COVID-19? Meaning that if you have not taken vaccine, the chance of death is almost 10 times higher than if you have taken the vaccine. If you have taken the vaccine, the chance of death will be 10 times less. That is number one. Number two is, any vaccine, however less efficacious it is, any vaccine available in the world today is at least 10 times more effective than any sort of treatment, any sort of medical treatment, be it antibodies, be it antivirals, be it anti-inflammatory medicines, be it traditional medicines, whatever. The worst vaccine is much more powerful than the best possible available treatment in India or the world at this point of time. So the problem with the hesitancy now is coming is, now initially we said all these vaccines were tested against symptomatic infections. Now that was the initial thing. Now we said that the vaccines will not give you symptomatic infections once you have taken. Pfizer 95%, Sputnik 91.6%, Covishield 76%, Covaxin 78%. We gave all sorts of number for lack of symptomatic infection. Now the problem has been, Israel was almost above 90% vaccinated, and then we have seen numbers rising like really anything. Now we are talking about hospitalizations. We are talking about deaths. That's why there is an erosion in the public mind. But what we have to understand is, at that point of time, we were dealing with an alpha variant. At this point of time, we are dealing with a delta variant. True, we talked about symptomatic infections at that time. The efficacy of Pfizer was 95% at that time. But when the delta came, the efficacy of Pfizer vaccination against symptomatic infections fell almost to 40-45%. But the efficacy of Pfizer vaccine or Covishield vaccine or Sputnik vaccine against hospitalizations, against death, is still above 90%. Almost all the studies across the world. And there were tremendous number of studies that were done. So why we have shifted from that point to this point is, virus has shifted its stand. So we have to shift our stand and educate accordingly. Now we are not saying symptomatic infections are greatly less, they are less. But the chance of dying, and then we are not ashamed to tell that. At that point of time, the science was different. At this point of time, with the Delta wave, the science is different. What you may ask me, what will happen if the Delta plus comes? Now I am talking about AY1 to AY12. There are 13 variants. There are 25 variants as of yesterday. And there may be a new strain that may come. If you have exhausted all the Greek variants, they are going to name the new variants according to the stars. Okay, we may have an Andromeda strain that may come. Now, you may ask me, if you are talking about less hospitalizations and less deaths now, tomorrow, if a new variant comes, you will talk about a new thing. For that, I have one defense, ladies and gentlemen. One defense. Why are these variants coming up? Why are these variants coming up? This is because we are allowing the virus to spread among the population without any checks. Once the virus replicates, the Darwinian principle takes over, and new variants which are fitter which are stronger, which are more transmissible will come in. When we vaccinate, the chance of replication is much less. The viral replication is much less. You have an Israeli study which says that the CT value that is seen in the RT-PCR test, the value is much less. That means the number is much more. That means the viral load is much less in people who are vaccinated. What I mean to say is CT value, if it is more, that means that the viral load is less. So viral load is less in people who are vaccinated. That is the trial that has come. So if you do the vaccination fully, the chance of having a new variant comes down. Variants are not caused by the vaccination. Variants are prevented by the vaccination. That is an important and fundamental rule. We are doing new variant assays with INSACOG laboratories, and then we should do more and more work to recognize these variants early. And these, ladies and gentlemen, are my opening remarks. I look forward to any questions that you may have. Thank you very much.